Welcome to Ulosca channel. Access all nursing practice questions. ATI Pediatric Unit 3 Assessment Practice Questions with Answers.
Question 1. What is a normal respiratory rate for a toddler? A. 12-20, B. 20-30, C. 30-50, D. 10-18. Which one is the correct answer? The correct answer is B. 20-30. Explanation. A toddler's normal respiratory rate is 20-30 breaths per minute. Anything higher or lower may indicate a respiratory issue. Question 2. Which is a priority concern in a child with croup? A. Drooling, B. Barking cough, C. Fever, D. Runny nose. Which one is the correct answer? The correct answer is A. Drooling. Explanation. Drooling can be a sign of severe airway obstruction and requires immediate attention, especially if paired with stridor or distress. Question 3. What is the best position for a child in respiratory distress? A. Supine, B. Trendelenburg, C. Upright, D. Prone. Which one is the correct answer? The correct answer is C. Upright. Explanation. Upright positioning helps maximize lung expansion and oxygen intake, reducing respiratory effort in distressed children. Question 4. Which vaccine protects against whooping cough? A. HIB, B. IPV, C. DTaP, D. MMR. Which one is the correct answer? The correct answer is C. DTaP. Explanation. DTaP includes protection against pertussis, the bacteria responsible for whooping cough, a serious respiratory infection in children. Question 5. What is a sign of dehydration in infants? A. Soft fontanelle, B. Moist mouth, C. Sunken eyes, D. Frequent urination. Which one is the correct answer? The correct answer is C. Sunken eyes. Explanation. Sunken eyes are a classic indicator of moderate to severe dehydration and signal the need for immediate fluid replacement. Question 6. What is a common trigger for asthma in children? A. Cold air, B. High calcium diet, C. Daily naps, D. Low sugar. Which one is the correct answer? The correct answer is A. Cold air. Explanation. Cold air often causes bronchospasm in sensitive airways, making it a common asthma trigger in pediatric patients. Question 7. Which medication is used in acute asthma attacks? A. Albuterol, B. Amoxicillin, C. Loratadine, D. Ibuprofen. Which one is the correct answer? The correct answer is A. Albuterol. Explanation. Albuterol is a short-acting bronchodilator that quickly relieves wheezing and shortness of breath during an asthma attack. Question 8. A child with otitis media will likely show A. Sneezing, B. Ear pulling, C. Rash, D. Diarrhea. Which one is the correct answer? The correct answer is B. Ear pulling. Explanation. Children frequently pull on their ears to relieve the discomfort or pain associated with middle ear infections. Question 9. What symptom suggests worsening bronchiolitis? A. Cough, B. Lethargy, C. Runny nose, D. Normal appetite. Which one is the correct answer? The correct answer is B. Lethargy. Explanation. Lethargy in infants is a late and serious sign indicating poor oxygenation and increased respiratory fatigue. Question 10. Which finding is expected after tonsillectomy? A. Bright red bleeding. B. White scabs on throat. C. Severe ear pain. D. Cough with sputum. Which one is the correct answer? The correct answer is B. White scabs on throat. Explanation. White or gray scabs in the throat are a normal part of the healing process following tonsil removal surgery.